Local health officials are pleading with Nebraskans not to get lazy when it comes to protective health measures.
The warning comes on the heels of President Trump's situation and higher numbers right here in the metro. Liliana Pearson joins us live. Liliana.
This picture here was taken at the Rose Garden 9 days ago, and it shows many unmasked and not socially distanced people, several of who have now tested positive for COVID-19. Nebraska medicine and UNMC doctors say they're seeing gatherings like this here in the metro, and they're contributing it to the recent spike in cases. In a tweet Monday, President Trump said not to be afraid of COVID. Nebraska medicine and UNMC doctors say with recent numbers, you should be.
This is potentially a perfect storm for Nebraska.
As Omaha City Council members question whether they should extend the mask ordinance Tuesday, local health leaders say now is the time to double down, not get lazy.
I do not think that this is the time to rescind the mask mandate for the city of Omaha. This is the time actually to expand that mandate throughout the state.
They blame loosening restrictions for a recent spike in cases.
We know how to beat this virus, but we've gotten complacent. COVID-19 has now killed nearly 500 Nebraskans, and many more are likely to die if we don't take more immediate action.
Doctors say they're constantly learning more about the virus. That includes using an experimental cocktail of drugs to treat it, including some the president took while hospitalized.
We're doing them in a responsible way in which patients who meet indications are receiving the appropriate medications, or we're giving them in a study situation to fully elucidate how helpful they are and in which patient populations they should be used for.
The doctor's take-home point, if we don't slow the spread, we will not have enough hospital space this winter.
We all have the power to slow this down. But if people do not change the way we are currently behaving, we are not going to have capacity. And the assumption that you can if you get sick, that we're going to have a hospital bed for you is a false assumption. We can fill. Lincoln can fill. Omaha can fill. Grand Island can fill. All of our hospitals can fill up.
You don't want to be in life-threatening conditions and not in an ICU. And the chart that you're seeing here actually tells us a lot. This is the amount of hospitalizations here in the state of Nebraska. And you can look here, see this upward trajectory. This is upward movement that doctors are not wanting to see. And we are also near an all-time high with 271 people. Iowa also near an all-time high. Now take a look at this. In May, capacity at metro hospitals was at 50% when restrictions were lifted on who could take a bed at the hospitals. Right now, they're at 85%, mostly for patients who don't have COVID. But the concern is if more COVID cases continue to rise, especially with the flu season. On your side, Liliana Pearson, 6 News.